Hi, my name is Amrita and I'm a postbaccalaureate research fellow at the National Institutes of Health. When we eat, our bodies produce insulin, a hormone that allows our cells to harness energy from food. However, in people with insulin resistance, the usual amount of insulin is less effective, so the body must make a lot more of it. As a result, people who are insulin resistant have a much higher risk of developing type 2 diabetes and heart disease. For reasons we don't fully understand, people from certain racial and ethnic groups, such as African Americans, South Asians, Native Americans, and Latinos, are more likely to develop insulin resistance. As a South Asian with a family history of diabetes and heart disease, I want to understand why people like me are at greater risk for these diseases. To answer that, we need to be able to accurately measure insulin resistance. The test commonly considered the gold standard for that is the glucose clamp, which can only be done in a hospital setting and requires several hours of blood sampling. While there are simpler tests to measure insulin resistance, they are less accurate at identifying the condition in racial and ethnic minorities. To address this issue, my lab mates and I assessed insulin resistance by measuring particles called lipoproteins, which are usually found in higher amounts in the blood of patients with insulin resistance. We call this test the Lipoprotein Insulin Resistance Index, or LPIR, and we found that it accurately and reliably measures insulin resistance in South Asians. Even better, unlike the glucose clamp, the LPIR only requires a single blood sample. My lab mates and I hope that the LPIR can assist doctors in detecting insulin resistance at an earlier stage and in a larger number of individuals, particularly those from communities that have been underrepresented in scientific research. As a result, more people will be able to take steps that will lower their chances of developing diabetes and heart disease.